Gallstones. So there have been few questions asked on the most common type of gallstones and the specific features of the various type of gallstones. So we shall be discussing them in this module. But before going to that, let's understand the factors that contribute to the gallstone formation. So the factors associated with the gallstone formation, this image has been taken from the textbook of Bailey and Love, are impaired gallbladder function. So if there is defective emptying, absorption or excretion, it might lead to gallstone formation. Then the supersaturation of bile, which is influenced by age, sex, genetics, obesity and diet. So let's understand the concept of the supersaturation of the bile. Cholesterol is insoluble in bile, right? Water is the main constituent of bile. Now, this is made soluble, that is, cholesterol is made soluble in bile by phospholipids and bile acids, which form mycelium. So now what happens is, if the bile becomes a lithogenic bile. Now what do you understand by this lithogenic bile? So basically there is increase in cholesterol and decrease in bile acid, as a result of which what is going to happen? Cholesterol crystals are going to form. Now the absorption of intrahepatic circulation of bile acid. So I said in my this pathogenesis of lithogenic bile that decrease in bile acid. So how would the bile acid decrease? The bile acids would decrease by the intrahepatic circulation, which would be by deoxycholate, bowel transit time, ileal resection or use of cholesterol. And then as over here cholesterol crystals are formed, they're going to nucleate. So the nucleating factors would be the mucus, glycoprotein and infection, as a result of which your gallstones are going to form. Now the cholesterol stability and the concentrate is interdependent on this three factor, which is the percentage cholesterol, the percentage of bile salts and the percentage of lecithin. So this is very important. This is called the triangle of solubility. So you could get an exam, an image based question asking what is this, or you can be asked what are the components of triangle of solubility. So moving next, next part is the types of gallstone. So what are the various types of gallstone? As we all know, it's cholesterol, pigment and mixed, right? So now if you asked what is the most common type of gallstone in India, your answer should be pigment gallstones. Now if you are asked what is the most common type of gallstone in Western, it is cholesterol, which could be pure or mixed gallstone. So now let's understand some of the important features of this pigment gallstone. There are two types of pigment gallstone. One is the black pigment gallstone and the second is the brown pigment gallstone. So where are this found? The black pigment gallstone is found in conditions of lysis. So there could be a clinical scenario given to you where a patient is undergoing hemolysis, like in any of the clinical scenarios where the patient is undergoing hemolysis, then you could be asked what is the type of gallstone found over there. It would be a black gallstone. Then it's also in hereditary spherocytosis, in cirrhosis of liver, and sickle cell disease. Then coming down to the brown type of gallstones, these are the stones which are found primarily in the CBD. Right, so these gallstones are found in the CBD associated with the parasites, which we'll be discussing also in the case of cholangiocarcinoma, which are also the risk factors. One is the Chlorkis sinensis, and also Ascaris lumbricoides. So these are the few important points that need to be remembered in with respect to the types of gallstone. So now what does this gallstone do? So let's again recollect the biliary tract, right? So in the gallbladder, here we are discussing the effect of gallstones. So what can it do with gallbladder? It can cause acute cholecystitis. It can cause chronic cholecystitis. It can cause mucocele. It can cause pyocele. It can cause GB cancer. It can cause GB perforation. Right. Then if it comes down to the common bile duct, so what are the features that can cause in common bile? It can cause obstructive jaundice. It can cause cholangitis. It can cause pancreatitis. Now so this is your duodenum and this is your intestine, right? So now what if the gallbladder stone comes and gets impacted in the intestine, right? So if gallstone ileus, if it comes and gets impacted in intestine, it can cause gallstone ileus. So with gallstone ileus, you have a triad which is associated known as Wriggler's triad. So this is often asked in your exam. What are the components of Wriggler's triad? So in Wriggler's triad, you find multiple air, fluid, 11 air in biliary tree, and stone in ileum. Now this gallstone may also get impacted in the first part of the duodenum, right? So if it gets impacted at first part of duodenum, it is called as Bovert syndrome. Now there's another syndrome which is associated with this gallstone, which is known as your Merizi syndrome. So what happens in Merizi syndrome is that the common hepatic duct is getting obstructed by the stone impacted at the neck of the gallbladder. So CHD, which is your common hepatic duct is getting obstructed by external compression of stone impacted at neck of the gall bladder. So here is your gallstones. This gallstone in gallbladder could cause acute cholecystitis, chronic cholecystitis, mucocele, pyocele, GB cancer, GB perforation. If this stone travels up to the CBD, it could cause an obstructive jaundice, cholangitis, pancreatitis. If it gets impacted at the first part of the duodenum, right, then it could cause the Bowert syndrome. Now, if there is this stone which is impacted at the neck, right, it can in the neck, it can cause compression in the common hepatic duct, which would lead to the Mirizi syndrome. If the gallstone reaches the intestine, it can cause the gallstone ileus, right? And over here we will have a regular strad. Also often asked in your exam is what would be the treatment in case of a gallstone ileus. Always remember that you just remove the stone from the intestine where it is causing obstruction, right? You never perform, not never, it's we usually do not perform, usually do not perform cholecystectomy in the same setting, right? Why we do not perform the cholecystectomy in the same setting? Because the patients are usually in such cases hemodynamically unstable where they're presenting with an obstruction. So it is important to get rid of the obstruction first and then later plan for cholecystectomy. Right. Now some extra add-on points over here. A triad is often asked, known as science triad. So let's understand what are the components of this science triad. This includes gallstones, diverticulosis of colon, and hiatal hernia, right? So this is all that I had to discuss in gallstone with you. So let's take a recap on the important thing in your gallstone. So first we discussed regarding the formation of the gallstone. As we understood, it is the lithogenic bile which is important, where there is increased cholesterol and the bile acid. We discussed about the factors of gallstone formation, which include impaired gallbladder function, supersaturated bile, cholesterol nucleating factors, and absorption and intrahepatic circulation of bile acids. Then we discussed about triangle of solubility, which determines the cholesterol concentrate, which is the percentage of cholesterol, percentage of lecithin, and percentage of bile salts. Then we discussed the types of gallstone, where most common type of gallstone in India is the pigment gallstone, and most common type of in the Western is the cholesterol stone, which could be either pure or mixed, right? Then the effects of gallstone, what it can cause in gallbladder, what it causes in CBD. Then we read about the gallstone ileus, regular start. We do not perform cholecystectomy in the same setting. Then the Bowert syndrome, at the first part of the duodenum the gallstone gets impacted. The Mirizi syndrome, where it is the compression of the common hepatic duct, which eventually leads to obstructive jaundice. Then you have science triad, which consists of gallstone, diverticulosis of colon, and hiatal hernia. Right, so that is from the gallstones.